Hello everyone, this session is about professional adjustment and career planning. It is our aim for this session to facilitate self-reflection and conceptualization on how you as student nurses at present can plan ahead, for your professional path and also your career objectives. So I hope that this session will help you, know, uh, to achieve clarity in terms of professional adjustment and career planning. You have learned from your previous course on fundamentals of nursing that a profession, must be dedicated to the service to humanity and social welfare, for the uh, common good of the society. Also, a profession must have a code of ethics and should be educated in higher education institution. Like in our case, we are regulated. The College of Nursing is regulated by the CHED, or the Commission on Higher Education. Also, another criteria of a profession is that it has members who is committed uh, to to the work or to the profession. So once you graduate as a student nurse, and uh, once you take your oath, as a full-fledged nurses, in the future, you are committing yourselves to a lifelong service towards your patients. Um, Also, professional association is another criteria of a profession, and in our case, Philippine Nurses Association is one accredited organization of which we are required to be a member. Also, a profession must have a specialized body of knowledge and set of skills. In nursing, we are to be compassionate workers, and we are to utilize the nursing process in rendering care towards our patients. Also, a profession uh, enjoys autonomy. So this autonomy enables the profession to conduct itself in accordance to uh, in accordance to the standards of practice to which it commits itself. Okay, so these are the criteria of a profession. I'm sure that by this time you're quite well aware that nursing is putting the patient in the best condition for nature to act upon him. And this we owe from Florence Nightingale. Also, I hope that by this time you are also very much conscious that nursing is a helping profession. And being a helping profession, it provides services which contribute to the health and well-being of the people. So we assist the patient, sick or well, in the performance of activities of daily living, which he or she could have done unaided, if she has the necessary strength, will, or knowledge. And if this is not possible, then assisting the patient towards a peaceful death will be our focus. And this is asserted also by Virginia Henderson in her theory. Okay, so uh, based on this, we can uh, conclude, that nursing as a profession addresses the needs of the patients, and these patients are either individuals, families, or population groups or communities. And our aim is for health promotion, health maintenance, and responding to the health problems. Of course, you have learned from your community health nursing, uh, and also and other nursing courses, know that our mission, our vocation as nurses, uh, is anchored on the reverence for the gift of life. And this is uh, very apparent, even in our code of ethics. The inviolability of life is one ethical principle or one principle that directs our actions, no, in our profession. Also, the respect for the dignity of each human being. No, that's why, regardless of differences, we are to practice non-judgmental attitude, and we need to continue to respect the dignity of each person. No? Right. So this principle guides us in our dealings with every patient, whether they are difficult patients, no? So yun. Also, we should not promote procedures that disrespect the sanctity of life because of this. All right. A professional nurse needs to have qualities and abilities. As part of the professional preparation, a nurse must have a license to practice nursing in the country. Also, the nurse must be a graduate of a degree of Bachelor of Science in Nursing. He or she should be physically and mentally fit. Also, she needs to develop the attributes of professional caring, which is asserted, no, proposed by Sister Mary Simon Roach. And these uh, attributes of professional caring includes competence, commitment, compassion, confidence, and conscience. So, in terms of competence, it requires that we should be able to know how to integrate our knowledge, skills, attitudes, and values, no, in practicing our profession or in rendering our nursing care. Also, compassion is the very essence of nursing, which we need to develop. In terms of conscience, we need to be able to develop that sensitivity, no, to follow legal, ethical, moral, and technical standards. Okay? So professional adjustment is basically the growth of the individual and the development of all his capacities, whether physical, mental, emotional, social, and spiritual. And we have discussed a while ago, no, about the qualities and the abilities of a professional nurse that he or she must possess. And as she continue, to grow in the profession of nursing, he or she must be able to adjust professionally, allowing himself or herself to grow, no, as an individual in nursing, no, in this profession. It follows also that a professional nurse must be aware of his or her professional duties articulated in the Republic Act 9173. And amongst these professional duties includes promotive, preventive, curative, and rehabilitative care in all healthcare service settings. Health education is also another independent nursing action. Utilization of the nursing process in patient care management is also one of our independent nursing action, because as you all know, basically all our tasks revolve, no, many of our tasks revolve around the application of the nursing process in patient care management. Establishing linkages, no, for the patient in different healthcare services is also one of our uh, independent nursing action. Training nursing students, supervision of subordinates, accurate recording and reporting, and even perineal suturing after receiving adequate training are also involved in our independent nursing actions. Even performing internal examination if antenatal bleeding is absent is also allowed, no, for nurses to perform, and conducting internal examination before delivery, no, of the mother. Now, there is one nursing action though that is dependent in nature. And this is the execution of valid doctor's order. But take note, valid doctor's order, meaning you also need to be knowledgeable. No, uh, why a particular order, no, is being advised, no, by the doctor. So we must uh, be able to execute, this doctor's order, uh, possessing also the required knowledge, you know, and familiarity of the doctor's order. Our execution uh, of such valid doctor's order is also our accountability. One concept in professional adjustment, and career planning that is worth discussing is the positive imaging of a professional nurse. And to develop this positive image, a nurse must be able to do self-evaluation or self-assessment. So what is self-assessment or self-evaluation? It is a process of looking at oneself in order to assess aspects that are important to one's identity. So this self-assessment or self-evaluation is a way, to or a process in which we learn more about ourselves, a way in which self-esteem or confidence can be enhanced. And self-assessment or self-evaluation is actually the first part of career management process. No, because you cannot offer something which you do not have, and you have to be aware of what you have. Okay. Next is self-awareness. To be able to develop a positive image, a nurse must be self-aware. And self-awareness is having a clear perception of your personality, including your strengths, your weaknesses, thoughts, beliefs, motivation, and emotions. Um, because being self-aware, is knowing. So what do you need to be aware about? So what do you really want in your life? What makes you happy? What do you want to change about yourself or about your life? What is your philosophy in life? What uh, philosophy in life in terms of whenever you are at a loss, this philosophy will guide you to the right direction. Or whenever you are in a dilemma or in an ethical conflict, your philosophy of life or your philosophy in life will help you make choices. No? So you have to be clear with your philosophy in life. Also, you need to be aware about your achievement so far, and also awareness about how you relate to others. No, you also because you also need to be aware about how to improve yourself as a person. Self-awareness of the most important beliefs and values are also important. It gives clarity. It will help you also to achieve clarity in terms of your philosophy in life. As you become more self-aware about your beliefs, your values, what you hold dear, what's important to you, yan. And how do you see yourself as a person? How do you adhere to good values? And how do you develop self-awareness? So you can maybe read good books, or maybe you can have a mentor, a life coach, or yeah, engagement with your family and your friends, and self-reflection, so that you will continue, to develop self-awareness. I remember a friend, more than 10 years ago, who asked me, do you do examination of your conscience every day? So at that time, I was so surprised. Talaga, I need to examine my conscience every day. So, ganun pala yun. Examining conscience is examining oneself. What went well during the day, what went wrong, what were your mistakes, what were your strengths, how else can you improve the next day. So as you regularly do it pala, you become a more self-aware person. Okay? So yun. With self-awareness, I'm sure you're quite very familiar of the Joharis Window, which is a simple and useful tool, no, for illustrating and improving self-awareness, and to develop mutual understanding between individuals within a group. Okay, so I will not anymore discuss the Joharis window. As part of self-awareness, we need to be aware about the level of skills that we have developed already as a nurse. And Patricia Benner's theory, can help us assess ourselves, no, about the level of the skills that we have developed so far. No, Dr. Patricia Benner introduced the concept that expert nurses develop skills in understanding of patient care over time through a sound educational base as well as a multitude of experience. And she proposed that one could gain knowledge and skills without ever learning the theory. She further explains that the development of knowledge in applied disciplines such as medicine and nursing is composed of the extension of practical knowledge through research and the characterization of and understanding of the know-how of clinical practice, or clinical experience. So she conceptualized in her writing about nursing skills as experience, that is a prerequisite to becoming an expert. Okay. So Dr. Patricia Benner described 5 levels of nursing experience, and these are the novice, the advanced beginner, the competent, the proficient, and the expert. I'm sure you have encountered already, the theory of Dr. Patricia Benner, which she also adapted, from from Dreyfus model of skills acquisition. Since our session is about professional adjustment, it would be good to know, to review again, the 5 levels described by Dr. Patricia Benner, hoping that as we discuss this, you will be able later on, to assess yourselves in the future about the level of nursing experience you will be gaining by them. So the first level is the novice. A novice is a beginner with no experience. The novice is taught general rules to help perform tasks. So rules are context-free, independent of specific cases, and applied universally. So this rule-governed behavior is limited and inflexible. A novice would usually say, "Tell me what I need to do, and I'll do it." Okay? Advanced beginner is a level 2. Um, an advanced beginner demonstrates acceptable performance. Uh, he or she has gained prior experience in actual situations to recognize recurring meaningful components. And the principles based on experiences begin to be formulated to guide actions. Okay? The next level is competent. So a competent nurse is typically a nurse with 2 to 3 years experience on the job in the same area or in a similar day-to-day situations. A competent nurse is more aware of long-term goals, and he or she gains perspectives, from planning own actions based on conscious, abstract, and analytical thinking, and helps to achieve greater efficiency and organization. 2 to 3 years of exposure, to patient care would help you, or would enable you to become competent nurses. A proficient nurse is the one who perceives and understands situations as whole parts. And a proficient nurse is more holistic in understanding, and also he or she has improved decision making. By this time, the proficient nurse learned from experiences, and they already know what to expect in certain situations. They also have experience in modifying plans. No? So they're able to troubleshoot whenever there are problems. Okay? An expert, on the other hand, no longer relies on principles, rules, or guidelines to connect situations and determine actions, because they have much more background of experience. They have intuitive grasp of clinical situations. So their performance tends to be more fluid, more flexible, and highly proficient. So it doesn't mean that an expert can do anything what she wants. Of course, her decisions or his decisions is coming no from coming from a place uh, of more intuition, clearer grasp of the clinical situation. Yun. So that's why decision making is very fast, no, for an expert because she can easily capture, no, what the nursing situation, and because of his or her very rich experience, she can easily she will know what to do and how to deal with a particular nursing encounter. So in assessing our level of skills, usually these different levels of skills reflect changes in three aspects of skilled performance. So, and these three aspects includes number one, movement from relying on abstract principles to using past concrete experiences to guide actions. Another important aspect is the change in learners' perception of situations as whole parts rather than in separate pieces. And number three is the passage from a detached observer to an involved performer, no longer outside the situation, but now actively engaged in participation. So in these three aspects, no, we will be able no, to assess how we progress no, from a novice to becoming an expert. As future graduates pursuing a career in nursing, we have what we call the four-step career planning process for nurses. And this includes first knowing yourself, exploring possibilities, making choices, and making it happen. So for general nursing, a career planning process might be a fine-tuning exercise. So you might want to work in particular wards or with particular types of patients. Or you might just need to identify what you need to do, to keep up to date with your practice. And then develop a plan for on how to make it happen so that your employer will agree to support you. However, you might also be looking for a bit of change in role of different focus. So you might be considering a change to a leadership or a management role, or be interested in doing some teaching or coaching or mentoring younger nurses or other staff. Or you may want to consider working in a specialty area. Now, good career planning involves usually these four steps that we mentioned a while ago. So, in knowing yourself, uh, you need, again, of course, to know your skills, your values, your aspirations, your motivations, your personality type, and your development needs. So, it's only you who's going uh, to be knowledgeable about these things because you know yourself better than anyone. The next step is exploring possibilities. So, as you try to examine training options, as you try to look for job prospects, for possible specialties, no, this step is very important in your career planning process because it allows you to have a wider set of options. And yeah, do not be scared to explore the different possibilities out there. And then the third one is to make choices. So identifying options that you think suits you and identifying any barriers that may need to be overcome is an important specific actions in this step 3. So you can be firm, no, about your decision. You're quite well aware about the different obstacles ahead or any barriers, and so that you will be able to develop a plan on how to overcome those barriers. And then the fourth step is making it happen. So how do you make things happen? Of course, first you need to come up with a plan. Diba? You record the plan of action. And then also identify steps on how to go about it, how to embark on any further training or work experience needed. So again, ikaw lang. Ikaw ang makakagawa nito because you you should you know yourself better nga than anyone. So only you who can also identify this specific stage, this specific steps that you need to take, no? So that you can make things happen. If you want to go to the United States, if you want to go to the UK, to Australia, or if you want to grow your roots here in the Philippines, ikaw ang makakaalam nun, no? So yon. So first, know yourself, you explore the possibilities, you make choices, because until you make choices, nothing will happen. So you have to make choices and then have the courage, have the fortitude to make it happen. Okay? But what are the factors ba that have influenced your career plans or might influence your career plans in the future? First, of course, is your abilities. Your abilities will definitely influence the career path that you will choose in the future. Also, how you develop awareness is very important. Knowledge of your own strengths, your weaknesses, and how to overcome certain barriers, no obstacles in your life. So, yon. Your education, of course, will have influence on your career path. Like, for example, right now, you're about to graduate in the with the degree of Bachelor's of Science in Nursing. And if you want later to take advanced uh, nursing practice, then you might need to enroll, no, uh, to a master's degree program, and then later on take your PhD. So these educational decisions, will of course influence and dictate the path that you are going to take. Okay? Motivation is another factor. Um, Sabi nga, ang isang taong masikap at masipag, talo niya yung matalino. No? It is the motivation that helps us persevere even in the most difficult times. Minsan, some intelligent people uh, are emotional, no? So they easily get disappointed, no? But your motivation, how you persevere, how you become determined to pursue, your career goals will have a big influence on the career plans and the career path that you're going to take. Luck is said to be one factor that may influence your career plans. So, yeah, or maybe luck or grace of God, no? So, yeah. Location is also a factor that can influence your career plans. So, if you want to be near your family and your family happens to be living in the province, So, syempre, you will be choosing a career path sa probinsya, ba? But if your family is abroad, so definitely you're looking forward to a career path that is leaning towards getting a job opportunity also abroad because your family is there. Like if your family is in the UK or in the US. Friends sometimes have influenced our career plans. So, di ba, mga magkakabarkada, like right now, ilan sa inyo, between your friends, are planning, o sige, sabay tayo mag-board exam, sabay tayong mag-apply sa ganito, sabay. So, yeah, sometimes friends, dictate our career plans. I remember when I was in college, no, as a student nurse, I have many friends. When I was in high school, I have a friend who told me, "Oh, let's go enroll to Philippine Normal University," because both of us wanted to teach. She pursued PNU, but I was not able to do so because I then enrolled in FEU to take up nursing because it is what my mother wants. No, so and then again in college as a student nurse, I have friends whose plans really is leaning towards getting job opportunity in the US. So my relatives also is in the US, so yun, why not go there? But then siguro on my end, friends really did not have much influence in my career path. Okay, family no is also one factor that influence our career plans. As I have mentioned to you a while ago, I took up nursing because it is what my mother wanted me to to take up. So yon. Money also uh, can influence our career plans. Uh, Initially, I wanted to be a teacher because I'm the eldest. I do not want my family to spend so much on me because I have other siblings as well. But maybe if we are richer, no, if we have more money, I could have taken up uh, medicine or maybe uh, taken up law because that's yun. I wanted to study law and medicine actually. But because of money, no, I'm the eldest and I have other siblings who will also study. So, yun. Inisip ko na lang maybe law and medicine is not for me. So, yun. Money can influence our career plans. Okay? So, how about you? What are the factors right now that influence your uh, career goals, your career objectives? As a young nurse planning, for a career path, uh, one has to be aware of the emerging opportunities, in our profession.